The connection between the gut and the brain is more profound than previously imagined, and inflammation plays a pivotal role in this relationship. The gut brain axis refers to the bidirectional communication between the central nervous system and the gastrointestinal tract. In recent years, this axis has gained attention for its role in mental health and systemic inflammation. Chronic inflammation has been closely linked to mental health conditions like depression and anxiety. Inflammatory cytokines such as IL-1, IL-6, and TNF alpha have been shown to cross the blood brain barrier and affect brain function, disrupting neurotransmitter balance, particularly serotonin and dopamine. Studies suggest that people with elevated levels of inflammation are more likely to experience symptoms of depression and anxiety, even when other risk factors are absent. This is why some anti inflammatory treatments like omega 3 fatty acids or anti cytokine therapies have been explored as adjunct treatments for mood disorders. Chronic inflammation also plays a role in the progression of neurodegenerative diseases like Alzheimer's and Parkinson's. In Alzheimer's disease, for instance, inflammation contributes to the accumulation of amyloid plaques and tau tangles, which damage neurons and lead to cognitive decline. Similarly, in Parkinson's disease, chronic inflammation in the brain is linked to the degeneration of dopaminergic neurons, leading to motor control issues. Targeting inflammation is emerging as a potential strategy to slow the progression of these diseases. The gut microbiome, comprising trillions of bacteria, fungi, virus, plays a crucial role in regulating inflammation throughout the body. A balanced, diverse microbiome promotes a healthy immune response, while an imbalanced or dysbiotic microbiome can trigger chronic inflammation. In conditions like leaky gut, the gut lining becomes more permeable, allowing harmful bacteria, toxins, and partially digested food particles to enter the bloodstream. This triggers an immune response leading to systemic inflammation. The gut barrier's integrity is closely linked to mental health, as these inflammatory responses can also influence the brain via the vagus nerve and inflammatory cytokines. The gut microbiome communicates with the brain through various pathways, including the production of neurotransmitters like serotonin and dopamine. When inflammation disrupts the gut microbiome, this can affect mental health, potentially leading to mood disorders. Moreover, chronic systemic inflammation from the gut can exacerbate conditions like depression and anxiety, further highlighting the gut brain axis's significance in overall health. The term inflammaging refers to the low grade chronic inflammation that develops with age and accelerates the aging process. It is a significant factor in the onset of age related diseases and the general decline in health that occurs over time. Now, as we age, our immune system becomes less efficient at resolving inflammation. This leads to the accumulation of inflammatory signals that can gradually damage tissues and organs, contributing to the aging process and the development of age related diseases. Chronic inflammation causes oxidative stress, damaging cellular structures like DNA, proteins, and lipids. Over time, this damage accumulates, leading to cellular senescence, a state where cells stop dividing but continue to release pro inflammatory molecules. These senescent cells create a pro inflammatory environment, further promoting tissue degeneration and aging. Now, as people age, the immune system becomes dysregulated, resulting in increased levels of pro inflammatory cytokines. This is known as immunosenescence, and it leads to a reduced ability to fight infections and increased susceptibility to chronic diseases, including cancer and cardiovascular disease. Inflammaging contributes to the stiffening of arteries called arteriosclerosis, increasing the risk of hypertension and heart disease. Chronic inflammation promotes the formation of atherosclerotic plaques, which can rupture and cause heart attacks or strokes. Inflammation also accelerates the loss of muscle mass and bone density, contributing to sarcopenia or muscle loss and osteoporosis. Chronic inflammation disrupts the normal repair processes in muscles and bones, making older adults more prone to fractures, joint pain, and decreased mobility. Inflammaging affects cognitive function by promoting neuroinflammation. This can lead to memory decline, reduced cognitive abilities, and an increased risk of neurodegenerative diseases like Alzheimer's. Inflammatory cytokines interfere with synaptic plasticity, impairing the brain's ability to form new connections and adapt to changes. The skin, the largest organ of the body, also shows signs of aging through chronic inflammation. Inflammaging can cause the skin to lose its elasticity, leading to wrinkles, thinning, and a reduced ability to heal from injuries. Now, while aging is inevitable, there are several strategies to reduce chronic inflammation and mitigate its impact on the aging process. A diet rich in anti inflammatory foods such as fruits, vegetables, whole grains, fatty fish, which is rich in omega 3, and healthy fats like olive oil can help reduce chronic inflammation. These foods provide antioxidants which combat oxidative stress and help maintain a healthy gut microbiome, which plays a key role in regulating inflammation. Regular exercise has been shown to reduce markers of inflammation in the body. Physical activity helps regulate the immune system, improving the body's ability to resolve inflammation. Additionally, exercise reduces visceral fat, a major contributor to systemic inflammation, and supports muscle and bone health. Chronic stress is a major contributor to inflammation as it triggers the release of cortisol and pro inflammatory cytokines. Practices like mindfulness, meditation, yoga, and breathing exercises can reduce stress and consequently lower inflammation levels. Poor sleep is associated with increased inflammation, while quality sleep is restorative and helps resolve inflammation. Sleep plays a critical role in immune function and tissue repair, so ensuring 7 to 9 hours of restful sleep per night is key for reducing inflammation. Advances in anti inflammatory therapies, including the use of drugs like metformin, statins, or novel anti inflammatory molecules, are being researched as ways to mitigate inflammation. These therapies aim to reduce the harmful effects of chronic inflammation without compromising the immune system's ability to fight infections. Now, proper diagnosis of inflammation involves a combination of blood tests, imaging techniques, and thorough patient history evaluation. The goal is to identify the underlying cause of inflammation and differentiate between acute and chronic forms, allowing for targeted treatment. The most common way to diagnose inflammation is via a blood test. Generally, the levels for CRP, ESR, and also other pro inflammatory cytokines are checked for. Then, imaging techniques such as MRIs, PET scans, X rays, and ultrasounds are also used to check for inflammation, whether in the body, in the general organ structures, or in the bones. And any such inflammation can be then marked out and then can be further investigated. Now, the most important step in diagnosing inflammation actually lies in ensuring that the history of the patient is accurate. Physicians will ask about any recent infections, injuries, exposure to allergens, or chronic conditions like diabetes or autoimmune diseases. The patient's lifestyle, including diet, physical activity, and stress levels, will also be evaluated as these can significantly influence inflammatory responses. By combining these diagnostic tools, blood tests, imaging, and a very comprehensive patient evaluation, healthcare providers can identify the presence and cause of inflammation, guiding appropriate treatment strategies. Now, treatment for inflammation starts with identifying the underlying cause. Inflammation can be of various types, and the underlying cause to each of those types can also be different. For example, it can be autoimmune, it can be in response to an allergy, and identifying the source is essential for targeted treatment. Now, once the cause has been identified, we move over to preventing chronic health issues. Chronic health issues like diabetes, heart diseases, and cancer. We need to ensure that the disease is being monitored. Inflammatory markers like CRP or ESR are useful in monitoring the progression of chronic conditions such as rheumatoid arthritis or IBD. And then we tailor treatments accordingly because now we have sorted out our diagnosis. With an accurate diagnosis comes with accurate treatment. Now, effectively managing and reducing inflammation involves a multi pronged approach, combining diet, exercise, medications, natural remedies, and stress reduction. By targeting inflammation through various means, individuals can lower their risk of chronic disease and improve overall health. Now, as we move to the end of this episode, I want to talk about the practical takeaways. Number one being managing your daily habits to reduce and prevent inflammation, which includes having a balanced diet, exercising regularly, managing your stress effectively, and sleeping on time. Then you also got to be mindful about the signs to watch out for chronic inflammation, which are persistent fatigue, joint pain or stiffness, digestive issues such as bloating or cramping, skin conditions like rashes or eczema, frequent infections or prolonged healing time. If these signs persist, it is important to consult a healthcare provider to rule out chronic inflammation. Now, routine checkups and blood tests like CRP and ESR are essential in detecting inflammation early, especially if you are at risk for chronic inflammatory diseases. Early detection allows for more effective treatment and better long term health outcomes. Inflammation plays a dual role in health. While it is crucial for the body's defense mechanisms, when left unchecked, it can lead to chronic diseases. Understanding the causes, signs, and management strategies for inflammation is key to maintaining overall health. By adopting a proactive approach to diet, exercise, stress management, and regular medical checkups, we can effectively manage and prevent harmful inflammation. Through lifestyle choices, we can reduce the risk of long term health issues and support a balanced inflammatory response. You were listening to the Dr. WashBrains podcast. My name is Dr. Akash Sehgal. Thank you for being a part of our podcast where we make health a dinner table conversation.